Because of slow intervention, I was bleeding at a point there in the hospital, right in front of me, in front of the doctors. They had no needle, no syringe, nothing they could do. I was admitted and the nurse came and gave me medication. I was pregnant and I looked at it and I told her, have they changed my medication? That was when she realized she gave me another person's medication.
In a world brimming with innovation and progress, there exists a harsh reality for millions of mothers and babies. For them, the miracle of childbirth is overshadowed by the looming threat of death. As of 2020, Nigeria's maternal and child mortality rate soared to a heart-wrenching 1,047 deaths per 100,000 live births, ranking it the third highest in the world. This means that every 2 hours in Nigeria, a mother loses her life-giving birth, and every 6 hours, a child takes its first breath, only to have it cruelly snatched away. Eden Venture Group is determined to tackle the unique challenges faced by mothers, newborns, and children by ensuring access to quality healthcare services. The fight against maternal and child mortality in Nigeria is far from over. But with every voice raised and every action taken, we can rewrite the story.
I got married and just like every other girl, I thought it was natural to get pregnant and give birth. But within those years, I suffered many losses. So I actually understood the pain women go through, but nobody talks about this, the shame, the stigma, the pressure. So I also gave birth to my daughter and I started bleeding afterwards. I thought I was going to die at a point because I was jerking from lack of blood. I was admitted in the hospital. I stayed for some days. I had cervical sacrilege. I was pregnant. And there's this mother who has waited for 8 years to have this baby. She was talking about the sacrifices she has made and was waiting. She was booked for a C-section on a Tuesday. So she was admitted on Sunday and the surgery was for Tuesday. On Tuesday, I went for my procedure, came back and I still met her. I was like, you've not gone to the theater? And she said she has not had anything from her team. At around 6 p.m. in the evening, she went into labor. The doctor on duty said she was having abdominal pain and she was contracting. He said no, they should give her Pentax. And I was worried. We kept saying that this woman is in labor. He said no. Meanwhile, the baby was in a breech presentation. This woman was in pain and eventually she was rushed into an emergency C-section. She lost the baby and the uterus ruptured. I was really, really sad because I know what it means to really desire a child because I went through infertility myself. Losing a child rips a hole in every mother's heart. Misinformation and whispers often prevent women from seeking help. And some of the ways we combat this is through open dialogue, by sharing our own stories, making them realize that they are not alone, there are other people like them. I remember this young lady, she was pregnant and she called me that she wasn't feeling okay. So I decided to check on her and I saw that she was convulsing and she was left at home. So I intervened. I told them, why didn't you take her to the hospital? They said, no, she's having a spiritual attack. So we took her to the hospital. Thank God for quick intervention. The doctors were able to save her life, but they had to terminate the pregnancy for her to be alive. The primary healthcare presently is really not functioning, and mothers within the rural communities don't go anywhere apart from that. That's why you see that those places, there's no form of intervention there. Also, if you look at our gynae emergency sections, most times you go to that place, there's no needle, no syringe, nothing. And that's the first place every woman, every mother having challenges go through for intervention. Late last year, I went to the hospital, I was having cramps, so I went to the hospital. Right there in front of the hospital, I went to gynae emergency. My cramps became contraction. Because of slow intervention, I was bleeding at a point there in the hospital, right in front of me, in front of the doctors. They had no needle, no syringe, nothing they could do. I felt helpless and pained. I was losing my child and there was nothing I could do and there was nothing anybody was doing about it. So the situation is very, very pathetic. So if we must combat maternal and child health mortality, then our emergency healthcare facilities for gynae cases must be very, very okay, with trained and caring providers in those facilities as well. For those who want to help, you can please try as much as possible to listen to anyone who needs to talk. You can share valuable resource that would help them. You can also advocate for change. Doing this would actually help make a difference. Let's connect, let's come together, break the silence, and create a future where every mother and child thrives.
Let's create a world where every birth is a celebration. Join the conversation now. Visit www.edenventuregroup.com/MNCH to learn more.